Patellofemoral instability is a condition that where the patella or the kneecap does not stay in the groove or track that it's supposed to. It comes out and then it has to get back in. It is a condition that is oftentimes associated with trauma, but in somebody who's had it happen to them multiple times can be associated with something as simple as walking or twisting or turning. It is a condition that does predominantly affect young women, so we see it a lot in the teenage and young early adolescent women. Oftentimes we'll see it in patients because of a trauma. The trauma is the inciting event, such as a slide into third base, but in patients who are predisposed to this because of the way that their bones are shaped or because of the soft tissue anatomy that they have, which makes them much stretchier and looser and controls their kneecap with less constraint, those patients have the ability to dislocate their kneecaps, whereas you or I would not. And those patients are susceptible for having an increased frequency once it happens, and the younger you are when it happens, and especially in patients who have open growth plates, we have seen that those patients are much more likely to have this happen again and again. Somebody has one initial dislocation and it's not associated with that fracture or piece of cartilage that's been knocked off and floating around in the joint. Generally, those patients are treated without surgery the first time. We generally let the knee calm down. Sometimes we'll pull the fluid out if it helps. We'll get the strength back in the knee, and we'll start the patient back on their road to recovery with physical therapy as their treatment. These patients who have recurrent instability, when their patella comes out more than on one occasion, and we've talked about the fact that they need surgery, there are several different ways to approach it. These patients can have soft tissue injury. The first time the kneecap dislocates, they actually almost always tear a ligament that controls their patella. It's like a leash on the patella. And when the patella dislocates, and it always dislocates to the outside of the knee, that all-important ligament on the inside of their knee is torn. It will, just like in an ankle sprain, heal back if we treat them without surgery the first time, but it will generally heal in a little bit of a stretched out and longer position, and it can be one of the problems, and often is one of the main problems in patients when they continually recur with the dislocations or these things continue to happen. It's oftentimes because that leash or that ligament is no longer intact and controlling the patella. When we talk about how to control these dislocations, we talk about two major types of surgeries. There's a soft tissue surgery that we can do, which is reconstruction or repair of that all-important ligament that we talked about, or there is actually the surgery where we can move the bone just at the level where it attaches on the tibia or on the shin bone, so that that distance and that pull on the patella is reduced, and it's much more in line with the kneecap, causing less of a pull and reducing their risk of redislocation. We will sometimes do these operations together if it is both a bony and a soft tissue problem, and they do have different recoveries, but both are very, very reliable in terms of creating a stable patella and preventing them from continuing to dislocate. The reason it is so important to do this after the second dislocation and not let them continue to dislocate is because stability is something we can really reliably produce after surgery. We can give somebody a stable knee after surgery. What we can't do reliably in orthopedics yet is restore the cartilage. So once they've lost that all-important cartilage or damaged it, we do have ways to help and ways to restore it and rebuild it, but nothing is as good as your own cartilage. So we want to prevent that from happening with the recurrent instability.